Hello, welcome to BEH 217 Behavioral Approaches at the Pennsylvania Institute of Technology. Today we'll be discussing techniques and applications of behavioral approaches. So let's review the goals of therapy by each approach. First, we have psychotherapy, which is to make the unconscious conscious, to challenge the client's basic premises and life goals. In other words, what is it that lives inside of us that makes us who we are? And we go back to our childhoods, we go to those moments that we've suppressed, and that gives us a pretty good concept of what psychotherapy is. Moving on to existential therapy. This is to help people see that they are free and to become aware of the possibilities, meaning understanding and identify factors that block their freedom. So the sense of existential therapy is that you can literally do and choose anything you want, but there are things that get in the way, whether it is our own feelings of limitation or, what we believe society is going to see about us or feel about us. Then we have person-centered therapy, which goes back to Abraham Maslow and becoming self-actualized and to become more self-directed, kind of a Oprah approach to things. And then we have behavior therapy, which eliminates maladaptive behaviors and teaches clients to confront faulty beliefs with contradictory evidence that they gather and evaluate. The emphasis is on assessment and evaluation. Choice theory or reality theory is to help people become more effective in meeting all of their psychological needs and to teach clients choice theory, looking at how they can make better choices. Feminist theory, therapy, to bring about transformation both in the individual client and in society, to help change the way clients view problems and what they can do about these concerns. So when you are looking at something like this, you are looking at not just how a woman who is experiencing problems in the workplace because she might be in a male-driven kind of job, but what she can do to help the men around her understand that there is no major issue with her being there. So it's not just about changing herself, it's about changing the way society views her, which obviously is going to be a much more challenging idea. What most therapeutic approaches have in common? The importance of the therapeutic relationship. Counseling is a personal matter that involves a personal relationship, and evidence indicates that honesty, sincerity, acceptance, understanding, and spontaneity are basic ingredients for a successful outcome. So, that relationship between the therapist and their client is the best indicator of when and how and if therapy will be successful. The classic relationship between the practitioner and the client remains fairly anonymous regarding the practitioner's perspective, and clients develop projections towards him or her. So you go visit a practitioner 2-3 times a week, maybe once a week, and you literally tell them everything you've ever experienced, and they don't share anything with you. So a lot of times the client will project information about you as the practitioner such that it becomes they've created an entire fictional life about you. However, the emphasis is on joint responsibility, on mutually determining goals, on mutual trust and respect, because the therapist's main task is to accurately grasp the client's world and to establish a personal and authentic encounter with them. The relationship is of primary importance. So however the client likes to see the practitioner or imagine what their life is like is really irrelevant. What's important is for the practitioner or the therapist to truly get a grasp of what is important and what's going on in the client's life. The therapist's attitudes and behavior count more than the techniques used. In behavior therapy, the therapist is active and directive and functions as a teacher or mentor in helping clients learn more effective behavior and engage the clients in an evaluation of their relationships. So, the therapeutic relationship is based on empowerment and impartiality. So, not only do you have to be fair and you have to look at a situation from all sides, but you also have to figure out how to help the client become more empowered to make good choices. Therapy is also a partnership. It is a collaborative partnership. Clients are viewed as the experts of their own life. And much depends on the purpose of therapy, the setting, the personality, and the style of the therapist, the qualities of the particular client, and the problems selected for intervention. If the person who is seeing the therapist is dealing with depression, if they're dealing with postpartum depression, which is the depression one experiences after having a baby, if they're going through a midlife crisis, any of these issues are going to reflect what the problems are that you're going to be working on in the therapeutic relationship. Regardless of the therapeutic model you may be working with, you must decide what relationship style to adopt, what techniques, procedures, or intervention methods to use, when to use them, and with which clients. And Table 15.5 in your textbook has a nice review of all the therapeutic techniques, but we're going to go over them in this PowerPoint as well. So, techniques of therapy. We have the psychoanalytic therapy. Key techniques are interpretation, dream analysis, free association, analysis of resistance, analysis of transference, and countertransference. Adlerian therapy. Techniques include gathering life history data, such as family constellation, early recollections, personal priorities, sharing interpretations with clients, offering encouragement, and assisting clients in searching for new possibilities. Person-centered therapy uses few techniques, but stresses the attitude of the therapist and a way of being. And again, this is more of that Maslow or Oprah approach to how to become a better, happier person is through looking inside of yourself. Gestalt therapy uses a wide range of experiments that are designed to intensify experiences and to integrate conflicted feelings. Behavior therapy has main techniques that include reinforcement, shaping, modeling, systematic desensitization, and relaxation methods. Cognitive behavior therapy includes a variety of cognitive, emotive, and behavioral techniques. Choice theory and reality therapy involves skillful questioning as a central technique used for the duration of the therapy process, which is going to put the onus of really becoming an excellent questioner, so to speak, on the shoulders of the therapist. And a friend of mine does this kind of therapy, and he spent many years working on how to develop a questioning system that is both gentle and probing at the same time. Feminist therapy is consciousness-raising techniques aimed at helping clients recognize the impact of gender role socialization on their lives. You know, a lot of times, especially with women who grew up in the 70s and 80s, they live this very unusual lifestyle because, on the one hand, their moms pretty much were the stay-at-home housewives, but as they were going through school, it was pretty much the idea that don't be a housewife, you need to go out and get yourself a job. So they had this conflict in how they were being raised. combine with that this idea that, women are supposed to be, whether you believe it or not, subservient to men in some ways. Again, society as a modern construct today does not perpetuate that in the United States. The idea of equality is very important. So, again, what we try and recognize is that it is a process and that true equality has not been reached yet. Postmodern approaches, main technique involves change talk with emphasis on times in a client's life when the problem was not a problem. Existential therapy stresses understanding first and techniques second. Family systems therapy, some techniques include genograms, teaching, asking questions, family mapping, and setting boundaries. So moving on to the applications of these approaches. Pay careful attention to the application of each type of therapy and how it may be used successfully. Remember, each of the therapeutic approaches has both strengths and limitations when applied to culturally diverse client populations. And especially in the United States, that's a very significant and important aspect. Whether you live on the East Coast or the West Coast or along the Gulf Coast, you are going to have a very diverse clientele, and you have to be aware of their cultural uniqueness in order to incorporate that into your approach to a therapeutic relationship. The psychoanalytic therapy contributes details and comprehensive description of personality structure and functioning. However, a limitation is the model stresses biological and instinctual factors to the neglect of social, cultural, and interpersonal ones. Adlerian therapy is an approach based on the growth model ideally suited to preventative care and alleviating a broad range of conditions that interfere with growth. This idea of Adlerian therapy really falls back to the idea of having a feeling like you're just not good enough, that you feel inadequate in some way, and that you need to overcome that. Existential therapy is suited to people facing developmental crisis or a transition in life, and for those with existential beliefs, that idea that maybe there isn't a God, and maybe, the choices we make are the choices we make, and there is no heaven or hell. Therapists help clients accurately grasp being in the world. However, it has limited applicability to nonverbal clients and to clients with a deep spiritual sense of being who have, really believe in destiny or fate. Person-centered therapy is applicable to individual and group counseling. It is well suited for the initial phases of crisis intervention work and for working with groups from diverse cultural backgrounds. Gestalt therapy addresses a wide range of problems and populations. Catalysts for opening up feelings and getting clients into contract with their present-centered experience. So, these are, Gestalt therapy really takes the little pieces of everything that we have wrong with us and tries to find the underlying major issue that can account for all of our minor or small problems that become a big problem. Behavior therapy is a pragmatic approach based on empirical validation of results. Its principles are applied in fields such as pediatrics, stress management, behavioral medicine, education, and geriatrics. So, again, the idea here is to work to manage something that's going on in your life. So, for example, with stress management, if you know that driving in traffic, for example, really causes you to have physical and emotional results, meaning anxiety, high blood pressure, elevated heart rate, elevated respiration, they're going to teach you some behavioral interventions that can help you manage this. Cognitive behavior therapy, widely applied to treatment of depression, anxiety, relationship problems, stress management, skill training, substance abuse, assertion training, eating disorders, panic attacks, performance anxiety, and social phobias. And again, this is a matter of taking the behavior and matching it with the thought process and learning how to control the behavior through the thinking process. Choice theory or reality therapy is geared to teaching people ways of using choice theory in everyday living to increase effective behaviors. Limitation is that it discounts the therapeutic value of dreams. So, a psychoanalyst is not going to be a big fan of reality therapy because, interpretation and dreams is very important to a psychoanalyst. Feminist therapy is the approach can be applied to both women and men with the goal of bringing about empowerment. Key concepts to the theory are the personal is political, the counseling relationship is egalitarian, which means equal, and commitment to confronting oppression. So feminist therapy is really about taking control of not just your life, but the society in which you live in. Postmodern approaches are solution-focused therapy, and it's well suited for people with adjustment disorders and for problems of anxiety and depression. Both solution-focused and narrative approaches lend themselves to group counseling and to school counseling. Family systems therapy is useful for dealing with marital distress, problems communicating among family members, power struggles, crisis situations in the family, helping individuals attain their potential, and enhancing the overall functioning of the family. And usually by the time a family makes it to family therapy, there is, either a full-fledged crisis occurring or there is some significant breakdown in the family unit. So again, the key for family therapy is to regain a fully functioning family dynamic. Quantitative measures of therapeutic success. So what that means is, how do you measure whether or not the therapeutic relationship is actually working? And for example, you get the flu, you have 102 fever, you hurt all over, you're sleeping a lot. After 5-6 days of being on medication and getting rest and staying hydrated, your fever is down, you're feeling better. Well, quantitatively, you can use, for example, your pain level or your fever as quantitative measures. But how do we do that when it is a feeling we're dealing with? Well, we use something called feedback-informed treatment, or FIT, and it's designed to evaluate and to improve the quality and effectiveness of counseling services. FIT is an evidence-based practice, and remember, we like those, that monitors client change and identifies modifications needed to enhance the therapeutic endeavor. Monitoring outcome and adjusting accordingly on the basis of feedback from the client must become a routine practice. This approach to practice requires continuous active client input, which is the most significant predictor of change in the therapy. So the more the client participates in their own therapeutic relationship, the more likely they are to feel that they are getting better. Scott Miller and his associates at the International Center for Clinical Excellence, ICCE, developed 2 4-item instruments to measure client progress and to rate the quality of the therapeutic relationship. The first is the Outcome Rating Scale, or ORS, which assesses the client's therapeutic progress through ratings of a client's personal experience of well-being in his or her individual, interpersonal, and social functioning. So this rating scale, very good, good, neutral, not so good, bad kind of thing. The Session Rating Scale, or SRS, measures a client's perception of the quality of the therapeutic relationship, which includes the relational bond with the therapist, the perceived collaboration around specific tasks in therapy, and agreement on goals, methods, and client preferences. So the outcome is one thing. The relationship with the therapist is measured exclusively by the second piece. And really, it's measured by the first piece also, because the outcome is not going to be as good if you do not have an effective and efficacious therapeutic relationship. So let's talk about integrating the approaches. Practitioners have been battling over the best way to bring about personality change, dating back to the work of Freud. For decades, counselors resisted integration, often to the point of denying the validity of alternative theories and ignoring effective methods from other theoretical schools. Today, psychotherapy integration has developed into a clearly delineated field. It is now an established and respected movement that is based on combining the best of differing orientations so that more complete theoretical models can be articulated and more efficient treatments developed. The concept of integration has emerged as a foundational pillar in the field. The majority of psychotherapists do not claim allegiance to a particular therapeutic school, but prefer some form of integration. So, most people will not call themselves one particular type of therapist. I'm just Adlerian. No, because what they're going to do is they're going to mix and match the therapeutic styles that are going to work best for that particular client. So, for example, you go to a buffet and they have lobster and they have shrimp and they also have chicken parmesan and they have stir-fried rice. Well, you might have a little Chinese food, you might have a little shellfish, you might have a little Italian food, because that's what you want. Well, it's the same thing in terms of therapy. You, as the therapist, use the best possible approaches with a client based on their issues. The integrative approach is characterized by openness to various ways of integrating diverse theories and techniques. The ultimate goal of integration is to enhance the efficiency and applicability of psychotherapy. The most common pathways towards the integration of psychotherapies are technical integration, theoretical integration, assimilative integration, and common factors approach. All of these approaches to integration look beyond the restriction of a single approach, but they do so in a very distinctive way. Caveat. In other words, warning. Pulling techniques from many sources without a sound rationale results in often contradictory confusion, which is detrimental to the successful treatment of clients. So, deciding to combine 2 or 3 theoretical approaches because you are curious to see how they work and that it doesn't relate specifically to this particular client is not going to be as effective as looking specifically at the problems the client is having and then choosing the different theoretical approaches that you're going to integrate. This method aims at selecting the best treatment techniques for the individual and the problem. The path calls for using techniques from different schools without necessarily subscribing to the theoretical positions that spawn them. One of the best known forms of technical integration is the basis of multimodal therapy, which is based on the need for customizing treatments depending on the patient. So on the right here we have a patient with ADHD, attention deficit and hyperactivity disorder. So we have to look at 6 different aspects. Their educational interventions, how it impacts maybe the parent, how the parent can go through parent coaching or learning or teaching so that they become more aware of the needs of their child, specialized therapy, vocational counseling, and the medication that often comes with ADHD. This method, theoretical integration, refers to a conceptual or theoretical creation beyond a mere blending of techniques. This approach emphasizes integrating the underlying theories of therapy along with techniques from each. Examples of this form of integration are dialectical behavior therapy, DBT, and that is being mindful, distress tolerance, coping, emotion regulation, dealing with your emotions, and interpersonal effectiveness, i.e., setting boundaries. Acceptance and commitment therapy, and emotion focus therapy. So as you can see, there are so many different kinds of therapy, even within the overarching idea of a theory. Assimilative integration is grounded in a particular school of psychotherapy, along with an openness to selectively incorporate practices from other therapeutic approaches. Assimilative integration combines the advantages of a single coherent theoretical system with the flexibility of a variety of interventions from multiple systems. An example of this form of integration is mindfulness-based cognitive therapy, which is called MBCT, which combines cognitive behavioral techniques with mindfulness strategies in order to help individuals better understand and manage their thoughts and emotions in order to achieve relief from feelings of depression. Moving on to the common factors approach, which searches for common elements across different theoretical systems. Common factors include empathetic listening, support, warmth, developing a working alliance, opportunity for catharsis, practicing new behaviors, feedback, positive expectations of clients, working through one's own conflicts, client factors, therapist effects, and learning to be self-reflective about one's work. These common factors are thought to be far more important in accounting for outcomes than the unique factors that differentiate one theory from another. Among the approaches to psychotherapy integration, the common factors approach has the strongest empirical support. So in terms of the evidence-based data, this is the one that is demonstrated to work the most well. Of all the common factors investigated in a psychotherapy, none has received more attention and validation than a facilitative therapeutic relationship. The importance of the therapeutic alliance is a well-established critical component of effective therapy. Research confirms that the client-therapist relationship is central to therapeutic change and is a significant predictor of both effectiveness and retention of therapy outcomes. So again, that therapeutic relationship between the client and the practitioner is vital to any kind of positive outcome. So why does integration dominate the field? Well, one reason for the movement toward psychotherapy integration is the recognition that no single theory is comprehensive enough to account for the complexities of human behavior, especially when the range of client types and their specific problems are taken into consideration. Psychotherapy should be flexibly tailored to the unique needs and context of the individual client. For all identical therapy, relationship style, and treatment method for all clients is inappropriate and can be unethical. So you can't use the same theory or same approach for every single client because every single client is going to be different with different problems. One of the big challenges to integrating approaches is the special needs of clients. The client's ethnicity and culture, as we've talked about before, and the concerns that bring the person to counseling challenge you to develop flexibility in utilizing an array of therapeutic strategies. Being an effective counselor involves reflecting on how your own culture influences you and your interventions in your counseling practice. So whether you're Christian, Jewish, Muslim, Hindu, Buddhist, your religion will impact you. Whether you're Caucasian, African American, Hispanic, Asian, it's going to influence you. And it may not influence you negatively, but there are influences and you have to be aware that these are going to be part of your therapeutic approach. Another aspect is the integration of spirituality and religion in counseling. The emphasis on multiculturalism has empowered people to define themselves from a cultural perspective, which includes their spiritual and religious contexts. Johnson views spiritually informed therapy as a form of multicultural therapy. Clients who are experiencing a crisis situation may find a source of comfort, support, and strength in drawing upon their spiritual resources. For some clients, spirituality entails embracing a religion, which can have many different meanings. Other clients value spirituality, yet do not have any ties to a formal religion. Whatever one's particular view of spirituality, it is a force that can help the individual to find a purpose for living. The emphasis on spirituality will be important in counseling practice, which makes it imperative that you prepare yourself to work competently with the spiritual and religious concerns that your clients bring up. In other words, you need to learn about the different religions, especially the ones that tend to pop up in your area. So, for example, the college is located in Pennsylvania, and we have a lot of Amish people. And the Amish people are the ones who still ride horses and buggies and don't use modern equipment unless they're dealing with, modern people. They'll use a cash register to take our money when we go view their... but in general, they tend to live as if it was still in the 17 or 1800s. So it's important to understand that there are people who, different religions that tend to be in certain areas. So, for example, Orthodox Jews tend to live near New York. In California, you're going to see a lot of New Age religions, whereas in the center of the country, you're going to see a lot of Lutherans, you're going to see a lot of Methodists, and so on and so forth. Down in the South, Southern Baptists, Pentecostals, and again, you need to learn about the different spiritual beliefs that each of these groups have so that you can better meet their needs. So, one of the most important aspects to realize as you become a practitioner is that you have to change with the times. Many practitioners who claim allegiance to a particular system of therapy are expanding their theoretical outlook and developing a wider range of therapeutic techniques to fit a more diverse population of clients. By accepting that each theory has strengths and weaknesses and is by definition different from the others, practitioners have some basis to begin developing a theory that fits for them and their clients. Developing an integrative perspective is a lifelong endeavor. As long as new theories are being developed, practitioners need to learn and incorporate the applied techniques into their work. So it is incumbent upon us to stay up to date and to keep informed and to pay attention to what's happening in our field. So let's talk about developing your own integrated approach. A survey of approaches to counseling and psychotherapy reveals that no common philosophy unifies them. Many of the theories have different basic philosophies and views of human nature. A word of caution: beware of subscribing exclusively to any one view of human nature. Remain open and selectively incorporate a framework for counseling that is consistent with your own personality and belief system and that validates clients' belief systems as well. In developing a personal integrative perspective, it is important to be alert to the problem of attempting to mix theories with incompatible underlying assumptions. By remaining theoretically consistent but technically integrative, practitioners can spell out precisely the interventions they will employ with various clients. Practitioners need to tailor their theory and practice to fit the unique needs of the client. And remember, that is always the most important thing. This calls for counselors to possess knowledge of various cultures, to be aware of their own cultural heritage, and have skills to assist a wide spectrum of clients in dealing with the realities of their culture. Cultural competence enables counselors to work effectively in most clinical settings. Practitioners demonstrate their cultural competence by becoming aware of their own and their clients' worldviews, and by being able to use culturally appropriate interventions to reflect their cultural beliefs, knowledge, and skills. To develop one's own integrated approach also takes experience. The ability to assimilate techniques from varying theoretical perspectives takes time, knowledge, and finesse. And the only way you get that is through a lifetime of experience. So much like driving, kissing, cooking, the more you do it, the better you get. So that's it for today. If you have any questions, please feel free to text or email me. Alternatively, if you're not in my class, please leave a comment and I'll be happy to get back to you with any answers I can provide. Thank you and have a fabulous day.